In this hearing, Representative Jasmine Crockett once again cuts straight through the fog of misinformation and political theater, and what she exposes is devastating. Her remarks weren't just another partisan clapback, they were a moral and factual indictment of a movement that claims to love America while dismantling the very systems that keep Americans alive, fed, and healthy.
Okay, Ms. Crockett.
And Mr. Chair, before I begin, I do have two UCs that seemingly work really well right here. One says farm bankruptcies in 2025 already exceed 2024 levels. That is from Hoosier Ag. And the second one says farm bankruptcies rising in 2025. All right. The reason that I wanted to talk about farming is because it seems like we think that we can talk about things in some sort of vacuum. You can't talk about healthy children if you don't talk about whether or not they have money to access any food, whether it's good or bad. Some would argue that if you don't have money to access food at all, whether it's good or bad, it's probably bad for the child to not have anything in their body. The reason that those on my side of the aisle keep bringing up these cuts is because we know that we already have a hunger problem in this country. Considering the fact that we have a hunger problem in this country, it's now only been compounded by the poor policies of this administration and House Republicans as well as Senate Republicans. You see, I don't believe that you can just have a mantra where you say, make America healthy again, without actually doing the work, because as the good book says, faith without works is dead. So let's talk about the work that really needs to be done. Number one, it's in policy. Policy that doesn't look like ridiculous tariffs that unfortunately now have our farmers going under. In fact, to be very specific, farm bankruptcies are up 55% compared to 2023. Which minimizes the amount of food that we do have that will be available. And ultimately, that food will be more expensive because that's simple economics. Yet at the same time, the $6 a day that people get to eat, that's going away. And besides the SNAP benefits themselves, we're talking about those kids that only get their food at school. And we are able to set the guidelines for whether or not that's healthy food or not. The reality is that I am so disturbed because under this Department of Health and Human Services, literally, they have become the threat to the American people. Serving from the state of Texas, unfortunately, we had to endure the very beginning of the measles outbreak. For the first time in 20 years, children are dying. That doesn't look like making us healthier again. In fact, a lot of people want to talk about measles, but the plague is back now. We had our first contact of that recently came out. And we know how the secretary feels about polio. Polio may end up coming back. Right now, President Trump, Secretary Kennedy, and congressional Republicans are perpetuating the most significant public health attack on Americans ever. In just a few months, they have diminished HHS's ability to respond to outbreaks and emerging health threats. They've dismantled teams that ensure Americans are consuming safe foods. They've weaponized the federal government against universities performing world-class research. They've implemented the most significant cut to healthcare in American history. These people hate it when American families have access to healthcare. They hate it when American families have access to healthy foods. They hate it when American families have access to affordable housing. They hate it when American families have access to affordable childcare because these people simply hate America. Nearly everything they have done makes Americans less safe and less healthy. The consequences of their actions are simple. More children will die and have. More children will go hungry. More children will live in extreme poverty. More children living with disabilities will lose access to school-based therapies and services. So, Dr. Fink, you're here to rubber stamp this agenda, an agenda that's so unpopular the Republicans are deciding to cheat in next year's elections. But nevertheless, let's talk about it. Dr. Fink, in 2021, you provided a presentation at the University of North Texas Health Speakers Bureau titled Women's Health. Do you remember that, yes or no?
Yes, I do.
Well, during this presentation, you spoke at length about the importance of vaccines. In fact, one of your slides stated, quote, clusters of under or non-immunization have the potential to foster transmission of vaccine-preventable diseases, including measles. Is this a slide from your presentation, yes or no?
I haven't reviewed that presentation recently,
So we're going to go you don't know. You work under someone who has become the face of the anti-vax movement. So who's right, you or the secretary?
Thank you so much for that.
You or the
Congresswoman.
secretary?
I would like to tell you that Secretary
You or the
Kennedy
secretary?
is challenging us to use gold standard.
So you're going to
science
filibuster,
together.
and I only have 25 seconds. So I'm going to go with you, assume you, but you know that he's your boss. This administration has lost all credibility with the American people and our global partners. No one believes you care about improving health outcomes when you're slashing NIH research into Alzheimer's disease, women's health, cancer, and diabetes. No one believes you care about public health when you cut programs that support maternal and child health and eliminate Healthy Start. No one believes you care about children when you implement the largest cut to Medicaid in history. Americans know the truth, and the truth is that this administration, with the help of congressional Republicans, has unleashed the most significant assault on public health in American history. The people will die as a result. I yield back the remainder of my time.
Let's unpack what really happened here and why it matters. Crockett begins by bringing receipts, literally. She cites reports showing farm bankruptcies surging 55% higher than last year. This isn't some abstract economic stat, it's a reflection of the real damage caused by GOP trade policies and reckless economic mismanagement. When farms fail, families don't just lose their land, America loses its food security. Food prices spike, child hunger worsens, and small-town economies collapse. Yet Republicans, instead of addressing that crisis, are slashing nutrition programs and social safety nets. Crockett reminds us that you cannot talk about healthy children without talking about whether families can afford to feed them. It's a simple truth, but one that gets ignored in the GOP's culture war distractions. When she says faith without works is dead, she's calling out the hypocrisy of politicians who invoke Christian values while implementing policies that harm the poor, the sick, and the hungry. It's performative morality, not governance. Then she turns her attention to RFK Jr. and Trump, and this is where her argument becomes razor sharp. Crockett links the rise of anti-vaccine rhetoric and the dismantling of public health institutions directly to the human cost we're seeing, the return of diseases we'd once eradicated, like measles, and even early warnings of the plague resurfacing. These aren't coincidences, they're consequences. When leaders wage war on science, when they demonize vaccines and gut public health funding, they put lives in danger, especially the lives of children. She accuses this administration and its Republican allies of conducting the most significant public health attack on Americans ever. That's not hyperbole, it's backed by policy. The GOP has slashed funding for the NIH, undermined the FDA, targeted maternal health programs, and gutted school nutrition and Medicaid. The result? More hunger, more sickness, more suffering. Crockett's words, "These people simply hate America," may sound harsh, but she's making a critical point. Loving America isn't about waving a flag or chanting slogans. It's about investing in the people who make up this country, our farmers, workers, parents, and children. When you cut healthcare, when you make it harder for people to eat, when you sabotage science and education, you are not protecting America. You are betraying it. Her questioning of the witness was also strategic. She exposes the internal contradictions within the administration's own ranks, where health officials once championed vaccines and science, but now serve under leadership that embraces anti-vaccine conspiracy theories. It's a subtle but powerful moment that reveals how political loyalty has overtaken professional ethics in public health leadership. The truth is, what Crockett is saying goes beyond partisan politics. It's about the soul of this nation. Are we a country that believes in evidence, compassion, and shared responsibility, or one that sacrifices its people for profit and propaganda? Crockett's closing line, that people will die as a result, isn't rhetoric. It's a warning. When we normalize lies about vaccines, when we shrug at child poverty, when we cut healthcare for millions, the result isn't theoretical. It's measured in lives lost. This hearing wasn't just a debate over policy, it was a test of values. And Jasmine Crockett made it clear which side stands with the truth, with science, and with the people who actually make America work. If you care about truth, about equity, about the basic right to live in a nation that values your health and safety, don't just watch this moment. Share it, talk about it, challenge misinformation when you see it. Because the fight for America's health is the fight for America's future. Call your representatives, support leaders like Jasmine Crockett who are standing up against this assault on truth and public well-being. The stakes couldn't be higher.